Carlos Icy with ESPN Los Angeles, and I am glad to be joined by Dr. Alan Beyer, introducing to you, our fans, the road to recovery, educating you about the injuries going on in LA sports and what's going on and how you can relate to it. So, Dr. Beyer, thanks for joining us.
Well, thanks very much, Carlo. Happy to be here. Since this is our first segment together, let me just briefly give a little bio so the fans know who's talking to them. My name is Alan Beyer. I'm an orthopedic surgeon, subspecializing in sports medicine. I've been in practice for 40 years now, all here in the Southern California area, seeing athletes of all shapes and sizes and just about any kind of injury that you can think of. So I'm looking forward to spending some time with you on the go forward and the guys at ESPN. And hopefully we can get the fans read in on what some of these injuries are soon after they occur and chart how the guys are progressing afterwards.
Well, thanks a lot again, Dr. Beyer, for joining us. You come at a perfect time. The NFL season is right around the corner. And for the Rams, it could spell bad news or tricky news at the start of the season with Cooper Kupp, their top player, an all-pro wide receiver, going down in training camp with a tight hamstring. What can you tell us about that, Doc?
Well, Cooper's had his share of injuries in his rather lengthy career already, right? We're dealing with a 30-year-old, very talented receiver, obviously. It's early in the season. We're just at the beginning of summer camp. Guys are all a little bit tight. A hot day when the muscles might be cramped a little bit. And he's doing, drills where he's running his routes that he's going to be running during the season. And a sudden acceleration is very hard on muscles like the hamstrings. So we're dealing with a hamstring strain. We don't know what degree of strain it is. We grade muscle injuries grade 1, 2, or 3, 1 being mild, which just suggests a little bit of a pull of some of the muscle fibers, no real structural damage. A grade 2 is a moderate strain where we think up to 50% of the muscle fibers can be damaged. And grade 3 is a complete tear. I don't think we're dealing with that here. He did have an MRI scan right after the injury, and I'm sure we would have heard if there was surgical intervention planned by this time. Grade 3 tears in professional athletes, if they pull the hamstring off of the pelvic bone, which is where it inserts, those require a surgical intervention on a player of this caliber. But any other hamstring strain, grade 1 or 2, or if it's a mid-muscle strain where the tears in the middle of the muscle, not near the bone, are usually not surgical injuries. So I don't believe we'll be looking at a surgical intervention for Cooper. I think that the key to rehabilitating a hamstring injury is slowly bringing the player along, starting out with the usual rest and ice, compression, elevation. Lord knows that these players at the professional level are getting round-the-clock care from their trainers. He's not just icing for the hour or two that he's at UCI training camp. He's getting iced 24/7 by these trainers. They're probably sharing a hotel room with him, icing him during the night as well. So he's getting world-class care in terms of the acute treatment. As far as what the steps are after that, it's mediated somewhat by the patient's level of pain. How much discomfort are they feeling? How are they coming back in terms of their strength? Is he able to resist somebody pulling against that hamstring and develop good contraction of the hamstring muscle, which shows that it's rehabilitating? And then they'll slowly starting back into gentle jogging, progressing up to running, holding off on the cutting or the sudden maneuvers until he's a little bit further down the road to recovery. And I think for a mild strain, you're usually looking at a week or 2, maybe 3. For a moderate strain, those can become nagging injuries if you don't treat them appropriately from the get-go. I think in this case, at minimum, if I were training staff and medical staff for the Rams at this point, I would probably say, why tax this guy in the preseason? Let him slowly come along. Let's nurse him back up to his normal strength slowly. You don't want to take a risk of further injury for a preseason game. You want to save him so he's good to go by week 1 if you can get him there. And I think it's probably reasonable to assume that he should be back playing by week 1.
I'm glad you mentioned that, Dr. Beyer, because Coach McVay and the Rams, they are infamously known for not playing their star players in the preseason. So maybe without a doubt, there was no chance of seeing Cooper Kupp in the preseason. The Rams have officially said that he is day to day and he is likely to play in week 1. But I'm glad that you do provide the timelines because I want to take a step back. I remember you first mentioned his history of injuries. We're talking about a ligament tear in 18, an ankle sprain in 22 that caused him to miss at least 8 games. And now this injury, the hamstring. Are those all connected?
Some players just do seem to be somewhat more injury prone than others. Is it because of the effort that they expend? Is it because of, I don't, and I'm not suggesting this in this case, but in the days of performance enhancing drugs, they were known to definitely weaken tendons in the long run. So some players back in the day who were utilizing testosterone and other androgenic drugs were more prone to getting injured because they were overworking their muscles, not letting them recover enough, and were getting more injuries. Certainly, we surveil for that a lot tighter now than we used to. So I don't think that's in play here. I do think genetically, some players do have a stronger versus a weaker collagen structure. They might be a little bit ligamentously lax or double jointed, as the general population tends to say. And those people might be somewhat more prone to certain injuries. And a tight person, a person who has very tight muscles, is obviously going to be more prone to things like hamstring strains and pulls. So there is some element of certain athletes being more prone to these kinds of things. His 3 injuries, though, are so different in terms of the mechanism of injury and the treatment that was done. His ligament injury was actually an ACL injury. He had an ACL reconstruction back in 18. His ankle sprain was a high ankle sprain, which also required surgical intervention and is notorious for being the slowest ankle injury to come back from. So for him to miss that many games is totally, not everybody can be Tua from the University of Alabama, who came back and played 2 or 3 weeks after tightrope surgery on his ankle, though that was somewhat controversial. But I think that Cooper is probably a little bit tight-muscled. He's got big, strong hamstrings, and when you suddenly explode with a forcible contraction and your foot is planted, it's not uncommon to develop a hamstring strain, and that's what we're dealing with here. Fortunately, as I said, it looks like we're dealing with something non-surgical.
Dr. Beyer, one, that's good news, but the bad news. On behalf of a lot of our fans who are also fantasy football fans, you mentioned 2 words, injury prone. Now, for us, we look at Cooper Kupp, who's been considered one of the top, if not the top wide receiver in fantasy football the last 2 seasons. He is a little bit of a lightning rod to touch because of his injury history. Now, looking at him, his history, how could that affect his future this season as being a reliable wide receiver for the Rams? And could this affect him even more throughout his career?
I think that because it happened this early in the season, and we basically have almost a month until the season itself starts. We do have a month until the season itself starts. It's unlikely that this is going to become one of those injuries that hampers him throughout the season. I have to tell you that part of our medical school curriculum never involved being a fantasy football prognosticator in terms of using your medical knowledge to figure out who to draft first and who not to draft first. I still think I would exercise a relatively high draft position for Cooper Kupp on my fantasy team. If it was his ACL or the ankle injury, I might be somewhat less optimistic. But with this particular injury, I think we can expect to see him back at 100% by about the first couple of weeks of the season without an issue.
So from fantasy football to reality, I don't have the same treatment options as Cooper Kupp does. Yes, I may have tweaked a hamstring sprinting down the track, trying to race a friend, or even at the gym doing workouts. But what does the average Joe, or how can the average Joe, how can they relate to Cooper Kupp's injury, and what treatment options are available for them?
So the first thing you got to do is listen to your body and not try to play through something when it occurs. If you're playing pickleball or you're playing tennis or you're doing something and you feel that tearing sensation in the back of your thigh that goes along with a hamstring injury, shut it down. Don't try to play through it. Stop playing. You're not making millions of dollars a year playing your casual sport. Be thoughtful, be intelligent, listen to your body, shut it down, ice it, rest it. And in a couple of days, if it feels it's not getting significantly better, that's when I'd go see the doctor. And I probably wouldn't, for this kind of injury, go to the emergency room or an urgent care center. You're basically going to see an ER or primary care doctor. Go see the orthopedic surgeon who you have a relationship with, because they're going to be a little bit more adept and specialized at figuring out the grade of injury, whether you need any diagnostic studies, and get you into an appropriate physical therapy referral. The emergency room and urgent care centers, save those for the fractures, the obvious injuries that need immediate attention, and they can get you pointed in the right direction. Injuries such as this, I think in a sophisticated population like we deal with day to day, go see the orthopedic specialist from the get-go and get the treatment set off on the right foot.
I'm very curious also. I want to add, Dr. Beyer, you mentioned about treatment options and if you feel it. What are some tips that you have on the average Joe, the regular athlete, everyday athlete, and what they can do to prevent and being able to stay loose?
So everybody, all of us, especially as we get older, need to spend more time stretching, even more than strengthening. The older we get, the tighter and stiffer our tissues get, and the more important it is to stretch and stay loose than it is to strengthen. I much rather, when a patient comes and tells me they're spending time doing Pilates or yoga or going to stretch lab or something like that, than working out at the gym and piling those weights on the bar and just lifting more and more or working the machines to get stronger and stronger. The older we get, the more important stretching is rather than strengthening.
Dr. Beyer, I'm going to head out to Stretch Labs right now and go ahead and get myself a little loose with the shoulders and hamstrings right now. But Dr. Beyer, thank you very much for joining us.
Happy to be here and look forward to doing it more as the season progresses.